My name is Courtney Stevens, and for my research, I chose the different types of hospitals throughout the United States. I have chose this topic due to there being so many different types of hospitals that I feel as into the field that we are going into and taking this class because of we all need to know the different types of hospitals from the major details just to the little details. The first type of hospital I'm going to talk about is the private nonprofit hospital. These hospitals can also be called voluntary hospitals. Um, with these hospitals, the real mission of the hospitals is to benefit communities in which they are located. Um, the They are owned by individuals, partnerships, or a corporation. It is to provide two distinct types of patients, those carrying government-sponsored insurances that reimburse on a fixed fee scheduled or caring for privately provided health insurance. These hospitals can charge more because they are allowed to, and they do because they are a private hospital. There is no set fee for the hospital. Church-owned hospitals also play a role in delivering services into the United States. That is churches or people from the church that want to help their community, which goes back to the voluntary hospitals. These hospitals are pretty much just here and there whenever they want to be. The next hospital I'm going to talk about is the private for-profit hospital. Um, these hospitals are also called investor-owned hospitals. They are practically the same as nonprofit hospitals. They nonprofit private hospitals, but they are just for profit. They pay property and income taxes. Nonprofit hospitals do not. A for-profit hospital is a hospital in which is organized for a nonprofit or corporation. The major goal of these kinds of hospitals is to provide a return investment to its stakeholders. These hospitals operate some of the largest multi-hospital chains in the United States. The next hospital I'm going to talk about is a general hospital. The general hospitals provide diagnostic, treatment, and surgical centers. These hospitals are the most common in the United States. They are for walk-ins, emergency departments. General hospitals do not mean that these hospitals are less specialized or that the care is less than any other hospital. All of these hospitals all hospitals practically can do the same unless they are a specialized hospital, which I'll get into that later. These hospitals provide a larger range of services for a larger variety of hospital. With that means you can go to a general hospital, you can get diagnosed, treatment, and surgery for your diagnosis, or just general checkups, any type of test that you need done. The next is the specialty hospital. These are primarily used to treat specific types of diseases or medical conditions. That's like a pediatric hospital. They are used to treat children, a cancer clinic that is for the cancer. These hospitals also provide services such as psychiatric care, rehabilitation, or even orthopedic surgery, just depending on which hospital or what kind of treatment you need. That depends on the specialty hospital. These hospitals sometimes can be considered community hospitals. These hospitals, they allow the community into it. Most of the time you will need a referral. A psychiatric hospital. These hospitals provide diagnostic and treatment services for patients who have mental illnesses. These psychiatric are mentally ill patients that need to be separated from other patients. Psychiatric hospital must have been a written agreement with a general hospital for transfer of patients who may require a medical attention. That's like Princeton Hospital is in contract with the Pavilion. They use their workers it's like an offset of the general hospital, Princeton Community Hospital, that their patients can go to a psychiatric hospital to get more evaluated more and cared for, in which they need. A rehabilitation hospital. These hospitals specialize in intensive therapeutic services to restore the maximum level of functioning in patients that have disabilities due to illness or an accident. That could also be hip replacement, any type of replacement that, or if somebody needs help walking again, that the rehabilitation hospitals provide these services so that they can get one-on-one physical activity done and make sure that they are capable of caring for themselves. Some patients transfer here from surgeries or receiving trauma care from a general hospital. Like I said, if anything was to happen for the patient to learn how to do stuff on their own again, they would go to a rehabilitation hospital. Children's hospital, that is like children's hospital are equipped with special furnishings made especially for children. Pediatric care, most people will most children will go to a children's hospital if their treatment or diagnosis cannot be done at a community general hospital. Children's hospitals have a staffing ratio that is higher than general hospitals because a child will need more help and care than an adult would. I'm sorry, I didn't mean to, well, it's not letting me go back, but not specifically, not all adults are gonna need less help than children. It's just within, children are gonna have to be kept an eye on more times than adults do. A rural hospital, the hospital was located in a county that is not part of a metropolitan statistical area. For the hospitals not to get shut down, they produced an agreement that allowed some rural hospitals to operate as a critical access care. That is because rural hospitals aren't as used as much as other hospitals are. So usually they let rural hospitals stay open for people that are closer to them in case for like critical care. Rural hospitals are the highest risk of closing due to them not having as many providers or patients. Teaching hospitals usually are universities that have their own medical center. For example, West Virginia University has their own medical center, when a provider that my mom worked for passed away, he sent his body back to the hospital, the West Virginia, where he had graduated from, so that those students could use his body to learn on. There aren't that many teaching hospitals in the United States. To be a teaching hospital, it must offer one or more graduate residency programs approved by the American Medical Association. And that, with that being said, there's only like 120 in the United States. An osteopathic hospital, doctors of osteopathic medicine are fully licensed physicians who practice in all types of medicine. That is usually just like a general hospital. Osteopathic doctors may they make a good amount, about 280,000. Osteopathic hospitals usually have a specific medicine that they practice, or allopathic and osteopathic doctors work in the same clinic and hospital. These are just with doctors in which you would need them. Osteopathic hospitals are equipped with those.